All right. Good morning, folks, and welcome to the Palliative Care Friday Chalk Talks. Today's episode is on dietary supplements, specific to those whose patients are being treated for cancer. And today we'll have a bunch of broad themes today, from unknowns to impact on mortality, harms, benefits, and what role supplements might have in relation to medical care. Today, we're delighted to be joined by our guest today, Dr. Philip Chang, who's an assistant professor practicing cancer rehabilitation medicine at Cedars-Sinai Medical Center in Beverly Hills, California. Following completion of residency in physical medicine and rehabilitation at SUNY Downstate, he completed a fellowship in hospice and palliative care at Montefiore and a second fellowship in cancer rehabilitation at the University of Michigan. Welcome, Phil.
Yeah, thanks so much for having me, Marty. It's really great to be here and really happy to be able to talk about this increasingly prevalent subject, I think.
Absolutely. So our format today will be a sort of a conversational interview, and then we'll have some time at the end for questions if anybody has some. So we'll jump right in for our first theme. So supplement use in oncology, it's common, it's accessible. People are not always open with divulging that they're taking them. How common is its use, and how can we be savvy in asking patients about this?
Yeah, it's I'm just gonna say it's really, really common. I'm gonna say it's might be the norm, if anything. Yeah, there was a publication in 2008 by JCO, and basically they found that 60 to 80% of patients are basically using some kind of supplement or natural product. There's a more recent study from 2023 that basically it was just in patients with breast cancer, but that found that 90% of patients use a vitamin and 70% of patients use a natural product. Certainly, like in my daily practice, whenever I talk to any patient who is like, has a recent cancer diagnosis, I feel like it's close to 100%. Of course, I'm in kind of a select part of Los Angeles, which, maybe more there might just be an increased use in my particular area, but I feel like it's extremely common. In terms of like asking patients about it, I think it's just, you're direct with it, and just like you review patients' medications with them when you're evaluating them, you just throw it in there and ask what supplements they're taking.
Yeah, not avoiding the elephant in the room kind of a thing.
Right, right, absolutely.
As a sort of a tangent, someone sent me a copy of Consumer Reports that happens to address this very issue, and it was interesting to see what the public might be seeing. And I'll tell you, I'm surprisingly impressed. I mean, I'll give you a few examples. They said for sleep problems, their top recommendation was cognitive behavioral therapy. They didn't reach for a med right away, which is our recommendation. They even referenced some of the same warnings and the same literature that you used in your fast fact. So there are some trusted places out there.
Wow, that's honestly really, really great to hear. I'm also kind of surprised by that, but that's no, that's really great to hear. But yeah, I think yeah, I remember reading an article in the New York Times, and I found similar information about, divulge any supplements that you're taking with, your medical team. So yeah, there's definitely a lot of good information out there, along with, less good
Yeah,
information.
that's for sure too. All right, so on to our next theme. What uncertainties exist with supplements in oncology, and why is it so gosh darn hard for us to know with certainty about safety and efficacy?
Yeah, no, so that's a really great and important question. So um, I think we I think we know very, very little. I think there's much more that we don't know than that we do know. And the primary reason is probably because in comparison to, prescription medication, is that it's just not regulated by the FDA. So supplements are categorized, I believe, more as a type of food. So they can actually go to market to the public without any um, basically checking of like what's actually in the supplement, or even checking the labeling. None of that has to be approved by the FDA. It can basically just go to market. In terms of like the lack of information regarding kind of its efficacy and kind of even what's in it, and kind of the lack of robust clinical trials. A lot of people basically say, it's not like the same as the pharmaceutical industry. They definitely don't have, well, okay, there's a lot of cash, there's a lot of money in supplements, but I don't know. There's not a drive, I guess. There's not an incentive for the manufacturers of these supplements to show improved efficacy. They can just make any claims again because their labeling is not regulated, so they can kind of do whatever they want to. They don't have to spend $100 million on well-powered randomized controlled trial. So yeah, I would say that's probably the primary reason. But yeah, there's just so much we don't know regarding interactions with medications, certainly interactions for people on chemotherapy. Definitely don't know that much about herb interactions with other supplements having interactions with those supplements. So yeah, I would say it's just a great sea of the unknown.
Yeah, I was taking a look at some of your source material and looking at some of the melatonin papers and how there was one in Canada back in 2017, and there's a more recent one in 2024 here in the US, and they're pretty similar. Like they tested a wide range of different melatonin supplements that were on the shelves and found dramatic variation in what was in them, ranging from 0% to more than 600% of what the label said was in there. And so,
Oh yeah, of course. And our colleagues at Memorial Sloan Kettering who helped us to write this fast fact. And I would just mention that they have a really wonderful repository for anybody who's listening of information about supplements. It's called aboutherbs.com. You can just Google search about herbs and you'll see it. And they have like a database of different supplements, and you can basically look up potential interactions or case reports about like adverse events. So they've done a really incredible job of putting that together. But yeah, again, it's just we don't one point that they brought up to me when I first met with them was that you don't, they can say that, this is like melatonin or ginger or garlic or ginseng, whatever it might be, but you don't know whether it's like the root or like the leaf or the flowering part. You just don't know. And, different parts like may have, different effects. So it's just, yeah, again, we just don't know. They could just say that it's ginger, but maybe it's all just like, the leaf part.
sure. All right. Um, can you talk a little bit about how oncology patients may not have mortality outcomes impacted by supplements, or at least what we think we know?
Yeah, so again, there's not really great studies. There's certainly no causative studies looking at this. However, there have been studies indicating association. So probably the study that we mentioned was a SWOG study, again from the JCO in 2020, that was looking for patients being treated with chemotherapy for breast cancer. And they found that patients who were on a wide variety of supplements, and they particularly kind of pointed out antioxidants, including vitamins like C and E, and they found that there were increased mortality outcomes. I believe it was a hazard ratio of 1.4 for patients on antioxidants. But they also found things like for other supplements, like iron, that it could be potentially associated with an increased rate of recurrence. So again, none of these were causative studies, so we can't say for sure, but certainly the association is there. And it's strong enough that there are certain organizations that believe it's the American Cancer Society that recommends that outside of a multivitamin, no supplements are used for anybody who's on active treatment for cancer.
Yeah, yeah, I took a look at that source material this week as well. That was interesting because they did have a multivitamin as part of that arm, and there was no
Right,
no
right,
change.
yeah. So that was, yeah,
Yeah.
exactly. So that was the one thing that they think is okay, and that most guidelines will say is okay, and it's something that I sort of say to tell my patients is okay if they want to continue during active treatment.
Yeah. Take home point, consult your oncologist. There's a lot of unknowns. Yeah.
Absolutely, yeah. Just yeah, the entire medical team, your oncologist certainly, the pharmacist. I think it's just important that everybody knows what you're taking.
Yeah. All right. So, other than the potential impact on mortality, are there other harms that you encounter or other harms that you worry enough about that you talk with your patients?
So in general, again, I guess it depends on where they are. So if they're if they're finished with active treatment, then I guess I'm not as worried.
Mm.
I can say, you can kind of take whatever you want. If there's I guess there are a couple supplements like St. John's wort, or Golden Seal, like those come to mind as having like lots of interactions. I believe there's multiple papers out there that recommend that if you're on any kind of prescription medication, you just avoid those. This isn't really a supplement, but maybe like grapefruit juice. So if I see like things like that, then I might start. I'll just go to like Up to Date, and then they use their drug interactions and Up to Date. They actually have a lot of supplements, not all of them, but there's a lot of supplements there. So, if it's there, then I'll just kind of look for interactions with anything that they might be on. But in general, yeah, outside of those three things, I would say if they're outside of active treatment, then I think it's okay. Um, or I'd say, or except for maybe blood thinners. If there aren't blood thinners, then yeah, again, I might be looking more closely and kind of be doing a deeper dive if there aren't any interactions with that. But other than that, yeah, um, I guess I take less precaution when they're off active treatment. But again, for patients who are on active treatment, yeah, my recommendation to them is usually to not take anything outside of a multivitamin.
It, for myself in the inpatient consult world, not in the clinic, probably one of the more common things that where I'm talking about that's not necessarily a supplement, but I kind of lump into that plant world is sort of your THC. And we're starting patients on buprenorphine, and THC is a CYP3A4 inhibitor and can impact somebody's ability to interact with some of these opioids. And that's probably my number one, just based on the population and where I'm at.
Yeah, no, it's really interesting that you bring that one up because yeah, that's or yeah, if we kind of want to throw it in that category, it's something that's definitely at increasing use, especially with changing legislation over the past 10, 20 years. And it's something that again, it's so common and so prevalent. If you start asking all of your patients about it, you may be surprised at how often like you'll find that people are already taking stuff, particularly if you're in a state where it's legalized for recreational use. Um, but yeah, there's been interesting, again, associative studies and findings with the use of cannabis products and immunotherapy. It's basically it's showing that patients may have increased mortality if they use those kinds of products while receiving immunotherapy. And I think it's such to the point that MASP actually recommends against the use of cannabis products if you are receiving immunotherapy. Yeah, it's really important to know, and I think it just highlights the importance of asking our patients.
Your fast fact examined some of the supplements that had some randomized controlled trial level evidence. Do you recommend any of the supplements that you talked about in your fast fact?
Oh yeah, that's honestly we actually recommend all of them. So that's kind of, there's so many, and this was kind of like one of the things that we had to talk about when we were writing the fast fact. It's like, what supplements we're going to use. There's like hundreds of supplements out there and different things that people can take. And we kind of just had to decide based off something. So we just decided based off what we regularly use in our clinical practice, understanding that other or other clinical providers probably use maybe a much wider variety of supplements. So yeah, that's basically how we did it. So it's just what we actually use in our clinical practice and hopefully future iterations. of other fats. Fats can include other kinds of supplements, but I would say, yeah, we recommend all these supplements. I've recommended all these supplements to patients before. The ones that I probably utilize the most are Wisconsin American ginseng, particularly for fatigue and cancer. Um, Tart cherry concentrate, which we commonly use for patients experiencing aromatase inhibitor musculoskeletal symptoms. And then magnesium for a variety of issues. Magnesium, something that we know works for constipation. But I would say the evidence is fair, and in the clinical experience, it seems like it works for muscle cramps. Um, but yeah, I would say magnesium and tart cherry I commonly recommend, and I think those actually work.
Hmm.
Yeah,
Yeah, I will admit that the only supplement that I have really any experience really digging into the literature is the Wisconsin ginseng. And what was so interesting looking at that study, comparing it to the one that you referenced from JACO from 2020 for the breast cancer, is that yes, it was a randomized controlled trial. Yes, it was placebo controlled, and it was done narrowly in a cancer population that was either a survivor or undergoing curative intent. So it was unlikely that it was going to impact something like mortality. And I think that's why, again, we still don't have a lot of literature about can we use these things in people that are undergoing chemo that may or may not actually work? Is it going to impact the efficacy? Is it going to impact their mortality? Because the ginseng randomized trial was done in those patients that were anticipated to do really well or already
right. Yeah.
had succeeded. So,
Yes, you're absolutely right. So yeah, you're right. The truth is we don't know. But like going back to the breast cancer study that should increase mortality. I believe that was when they were looking at supplements in aggregate, and they did find lesser correlations when they uh looked at individual supplements. So who knows? Maybe there's something there.
and then my last question before we open it up to the audience to see if they've got anything else for you is I've noticed within the hospital, I've met an increasing number of people that are, reading things online, right? There is so much out there, some of which may or may not be wonderful. And they're finding things about diets, supplements being these miracle alternatives to chemo, things that make claims that seem too good to be true. What sort of advice would you have for that patient?
Yeah, it's really crazy the amount of information that's out there now, and especially with these large language models like ChatGPT, and you can just like get into these giant kind of rabbit holes of just so much information. So what I think is I think that finding out information from a variety of sources is great. And I think that if yeah, I really think that it's best to try to find information from as many different sources as possible. So I think it's really important to find providers that you trust. And when you're talking about something like, treatment for cancer, I don't think it hurts to get like a second or third opinion. And just to find, yeah, different information from different sources. And then I think, yeah, just further educating yourself is always a good thing. Learning about strength of evidence and just, seeing how like a case report is different from like a systematic review. Just looking into all these things, I think is really great. So I would say, um, just keep looking for more information from different sources and just find providers that you trust.
Mm. I think that trust piece, it really resonates with me the most. The people I've met that have really strong opinions about certain things and a lot of mistrust of the healthcare, um, we have, I think here we have found ways to help them with their understanding of things, but only when you really sit down and they really trust you and they're willing to give you that time to listen to what you've got to say.
Yeah, I 1,000% agree with that. And the other thing that I might also add is that also seek opinions from people, outside, the regular medical establishment. Like support groups, I think are really, really great for that. And you can, find information from peers as well. Not just on, whatever treatments might be available or effective, but also, opinions about certain providers.
Yeah, absolutely. Well, thank you, Phil, for writing the fast fact. There is more medical information than anybody can know, and this allowed me to kind of go down the rabbit hole for a little bit with you, and I appreciate that.
Yeah, absolutely. And thank you again so much for having me on.
Absolutely. All right, everybody, have a wonderful Friday, and thank you, sir.